FMD is a congenital disease that affects the development of the wall of the arteries. The affected arteries tend to narrow, meaning becoming smaller, and decrease the blood flow to the organ that they supply. The most commonly affected arteries are the renal arteries, or the arteries that bring the blood to the brain, the carotid arteries. Depending on which artery is affected, patient can have different symptoms, specifically very severe hypertension or stroke-like symptoms. Patients with FMD often have no symptoms from this disease, and they are diagnosed when they undergo tests for other conditions. Patients most at risk for fibromuscular dysplasia are women in the childbearing age, mostly under the age of 50, or patients with a family history of FMD. FMD can be misdiagnosed as atherosclerosis or vasculitis, or really as any other disorder that causes vessel narrowing. That is why we at the Mass General Vascular Center have physicians who are trained in reviewing and making the correct diagnosis when looking at radiological studies. We at the Mass General Vascular Center can offer many different treatment options to a patient who suffer from FMD, from medical treatment to angioplasty with stenting to reconstructive surgery. The treatment option really depends on the severity of the disease. What is also important to know is that FMD cannot be cured, but can be controlled.